Relations of the sacrum. The ala of the sacrum from lateral to medial side, it is in relation with obturator nerve, iliolumbar artery, lumbosacral trunk and sympathetic chain. So you can remember these relations over the ala of the sacrum as OILS, from lateral to medial side. In the pelvic surface, the relations of the sacrum are the median sacral vessels. Lateral to the median sacral vessels, there lies the sympathetic chain or trunk, we can say, along the medial margin of the pelvic foramina. The upper 2.5 pieces of the sacral vertebra, it is in relation to the peritoneum, and sigmoid mesocolon is also in relation with the upper 2.5 pieces, whereas lower 2.5 pieces of the sacral vertebra is in relation with the rectum. Now let us see which are the various structures which passes through the ventral or pelvic sacral foramina, the dorsal sacral foramina and the sacral hiatus. Firstly, we will see the pelvic sacral foraminas. The structures which are passing through this are the ventral rami of upper 4 sacral nerves as well as the lateral sacral arteries. Whereas the dorsal sacral foraminas will be in relation with the dorsal rami of upper 4 sacral nerves. Whereas the structure which are emerging out from the sacral hiatus are the 5th sacral nerve as well as the pair of coccygeal nerve and phylum terminal. Sex differences in the sacrum. Sexual dimorphism is clearly seen in case of the sacrum of the female and sacrum of the male, because we want a wider pelvis in case of females as compared to the males, so that the fetus can lie in this pelvic cavity. In females, the sacrum is wider, and in males, the sacrum width is narrower, whereas the length of the sacrum is longer in case of males, whereas the length of the sacrum is shorter in case of the females. In females, we can see the sacrum is more curved, and in males, it is less curved, or we can say it is straight. So in this diagram, you can see how the width of the sacrum is more in case of females and the length of the sacrum is more in case of the male, as well as the curvature. If we see, it is more curved in case of females and it is straight in case of the males. And this can be calculated by means of an index which is called as the sacral index, that is the breadth across the base into 100 divided by the length from promontory to the apex of the sacrum is called as the sacral index, and this helps us to differentiate the male sacrum from the female sacrum. In males, the sacral index is about 105, whereas in case of females it is 115. Ossification of the sacrum occurs by ossification of 5 separate vertebrae. However, the upper 3 vertebrae have an additional primary center for the costal bars. And in total there are 21 centers, primary centers, and it is developed from 14 secondary centers. The 21 primary centers, if we have to divide this again, for body it is 5, arches the 10, and the costal bars it is 6. Thus a total of 21 centers are there, whereas the secondary center total is 14, of which the epiphyseal centers are 10, the center for the auricular surface are 2, and the margins which are below this auricular surface, again there will be the two centers, secondary centers. And as the most of the bones, the primary centers appears between 2nd and 8th week of the fetal life and fuses with each other between 2nd and 8th year of life, whereas secondary centers, they appear by around puberty and fuses by the age of 25 years. Regarding the anatomical position of the sacrum, hold the sacrum in such a way that the base is above, the apex is below. The pelvic surface is the concave surface which should be on the anterior aspect and it should be directed downwards and forwards. The upper surface of the body of the first sacral vertebra, it should be sloping forwards at an angle of 30 degree. Whereas the upper end, if you see from the upper end, there is one sacral canal which is lying here behind this. It should be directed straight upwards. So in this way you are going to hold the sacrum in the anatomical position. Now the last heading is the applied aspects of the sacrum. The first important thing you should know is the sacralization of the lumbar vertebra. Sacralization of the lumbar vertebra, it means if the last lumbar vertebra is incorporated into the sacrum, it is called as the sacralization of lumbar vertebra. If it occurs only on one side, it is called as unilateral, and if it occurs on both the sides, it is called as bilateral or complete sacralization of the L5 vertebra. Sometimes the coccygeal piece, that is the first piece of the coccyx, is attached to the sacrum. It is called as the incorporation of the first coccygeal piece. And sometimes what happens, instead of the 5 sacral vertebra which are going to fuse to form the sacrum, the first sacral vertebra will be separate and only lower 4 is going to form the sacrum. This is called as complete lumbarization of the 4 pieces. 4 pieces of the sacrum forming the sacrum. A gap which is formed on the dorsal aspect is called as the sacral hiatus, which we have seen over the dorsal aspect of the sacrum. There can be various shapes of the sacral hiatus. This is the inverted U shape, inverted V shape. This is the dumbbell shape. This is quite huge sacral hiatus. This is an M-shaped sacral hiatus, and this is irregular shaped sacral hiatus. So there can be various shapes of the sacral hiatus. This should be kept in mind while giving the anesthesia to the patient. Now just revise the summary of the sacrum, that as the sacrum is a triangular bone, it is having one base. We have seen it is having one apex, the pelvic surface, the dorsal surface, and there are the 2 lateral surfaces. Then we have seen the attachments of the sacrum, in which one should always remember about the muscular attachment as well as the ligamentous attachments over the sacrum. Then we have seen the relations of the sacrum, in which the ala of the sacrum, 4 important points I have told you, from lateral to medial side. One should remember as oils. O-I-L-S. O is for obturator nerve, I is for iliolumbar artery, L is for lumbosacral trunk, and S is for sympathetic trunk. So this is one of the favorite question of all the examiners, one should remember. Then we have seen various structures passing through this foramina, that is the ventral sacral foramina as well as the dorsal sacral foramina and the sacral hiatus which was there on the back side. Then we have seen the sex differences of the sacrum in males and females. How in case of the females we want a greater pelvic cavity, that's why the pelvic surface is more curved in case of females, whereas in males it is straight. The pelvic surface is also smoother as compared to the dorsal surface. Then we have seen how we are going to hold this sacrum in the anatomical position. Always remember that this angle is going to make an 30-degree angle with that of the horizontal. As well as the sacral canal should be in the vertical direction, and one should also remember that the base should be above and the apex should be lower down. The concave surface should be on the anterior side, and the convex surface, which is a rough surface, it should lie on the posterior aspect. Then we have seen the applied aspect, in which the lumbarization of sacral vertebra as well as sacralization of lumbar vertebra. This both concepts should be clear to you all. If we take a cut and see the sacrum, in this video you can see the sacral canal behind the sacral vertebra. This is the hip bone. See the curvature of the sacrum in this. The convexity is on the back side and the concavity is in the front side. So these are the 5 sacral vertebra, and this is the angle with the horizontal it is making a 30-degree angle. And here you can see this is the sacral canal. These are the sacral vertebra. So the point where the sacrum is going to end, it is the starting point of the pubic symphysis. Here lies a sciatic notch, and the 2 ligaments which are attached to it are the sacrotuberous ligament, which is this one, as well as one more ligament which we have seen, which is very important ligament, that is called as the sacrospinous ligament. Here is the attachment of the sacrotuberous to the ischial tuberosity, and one more ligament is the sacrospinous ligament. This is the sacrospinous ligament which is attached, thus converting this notch into the foramen. This was before notch, and because of this presence of this 2 ligament, this is now converted into the foramen. So in this you can also see that these are the 2 pelvic cavity which we are viewing it from above, in which the female pelvic cavity is wider as compared to the male pelvic cavity. This is the male pelvic cavity which we are viewing it from below, and this is the female pelvic cavity which we are viewing it from below. And we can see the difference between the pelvic cavity dimensions in male and as well as the females. So that's why sacrum plays a very important role in increasing the diameter of the pelvic cavity. Here we complete our topic sacrum. Thank you.